Hi, this is Mark Adahar from Chicagoland Men's Health. I'm one of the docs there. Hopefully you saw our video on how to inject your testosterone and how to inject HCG. Today's video is about our Sermorelin and Ipamorelin therapy and how to inject the medications. Now, Sermorelin and Ipamorelin are peptides, and peptides are amino acids. Basically, what they do is when you inject them over time is you get greater exposure to human growth hormone. Your human growth hormone gets optimized, and some of the benefits of human growth hormone optimization is you get faster recovery from workouts. You are better able to build lean muscle. You have a lot more energy because of easier fat mobilization. Your body fat percentage can go down as long as your diet and training are on point. Helps with injuries. Because it rebuilds the collagen in your joints and in your skin. When you rebuild collagen in your skin, you get a more youthful overall appearance. It's considered anti-aging because it can help slow down the aging process for all of these reasons. So, and of course, as a point is that when testosterone and peptide therapy like Sermorelin-Ipamorelin is combined, their effects are synergistic, so that they're using them together is greater than if you were to get treatment with one or the other. So we often recommend, if possible, is to do both therapies at the same time so you get maximal benefit. There's, if you want to. There's so much literature online and a lot of videos on YouTube about the other benefits of Sermorelin and Ipamorelin that you can look up, but I wanted to get to how to inject the medications. So you will receive a package at home with your medications. You will likely receive a box that looks like this, and inside this box you'll have two vials. One is bacteriostatic water, and one is the Sermorelin-Ipamorelin blend, 15 milligrams on there, okay? You'll also need your insulin syringe. This one's a 100 unit, you'll probably have a 50 unit one. And then you'll also get this, what we call a mixing syringe. It's a syringe with a needle attached in a green packaging. And you should also get an alcohol pad ready. So before any time you deal with any of your injections, make sure to wash your hands. I have already done that. And then, okay, so let's get started. So you will take your bacteriostatic water, pop off the cap. You'll take your Ipamorelin and Sermorelin blend and take off the cap. You can get everything ready. You want to take this guard off the insulin syringe, and then you want to unpack your mixing syringe, okay, and have your alcohol pad ready. Now, when you get your Ipamorelin, if you take a look here, you'll see it's a powder, okay? Obviously, you can't inject powder. We have to, what we call, reconstitute it or mix it with water, okay? So every time you use a vial, make sure you wipe the top of your of your vials to kill any bacteria, okay? Which I just did. Okay, now, to mix, you're going to take 9 milliliters out of this large 30 milliliter vial. Okay, so basically what I'm going to do is into the big mixing syringe, you will see I will take 9 milliliters. Okay. Okay, so you'll see 9 milliliters of this bacteriostatic saline. Water, I'm sorry, is going in here. Okay, so I'm full. That's actually 8. Let's do 9. That's 9. Okay, that's all you need. So you can throw this away. You're not going to need this anymore. All right. Then you take your vial. Okay, and what you do is I'm going to do it up here. You insert the needle into the middle of that. Remember. I already wiped it with alcohol, and then I'm going to push this in and aim towards the side of the vial, and then you'll notice that the syringe is going to go down on its own. Okay, there, and the syringe plunger, you'll see is going down on its own, and it's automatically mixing it. I'm aiming for the side of it. Okay, there, and then you gently turn it. You see on the bottom there may be a little bit of sediment. You just want to gently twist it and shake it so it gets fully mixed. Okay, just gently, because this stuff can be fragile, so don't drop it. You know, try not to jar too much. Also, every time in between use, it's important to refrigerate this. Okay. All right. So I'm mixing it. Okay, and then pretty much all the product is dissolved in the water. Okay. Don't mix it like that. You know, just kind of twist it around like this, very gently. Okay, good. Now, this is a subcutaneous injection, not like your testosterone where it's an intramuscular injection. This is a subcutaneous injection, okay? And we're going to fill your insulin syringe up to 30. Okay. So again, I'm going to wipe the top here. I'm going to insert my insulin syringe here, and I'm going to pull to 30. 30, perfect, 30, okay? Great. Okay, now, subcutaneous injection can be basically anywhere where you have subcutaneous fat underneath the skin. The most common areas are the love handles, around the belly button. You could do inner thighs, but I would recommend the love handles, only because of ease of access. It's important to rotate the sites. You'll be injecting this once a day for 5 days, and then off for 2 days. So in general, Monday through Friday, and don't inject on Saturday, Sunday, okay? And then just repeat until the product is gone. Okay, so now I will inject the medication. So I'm gonna choose my left side, because in the previous video I injected on I'm gonna choose my right side because the previous video I injected my left side. So I'm going to grab my love handle here, I'm gonna pinch. I'm gonna rub the area with alcohol. I'm gonna take the syringe and inject 1, 2, 3. There you go. Slowly draw it in. Inject. Awesome. Pull it out. Check for any bleeding. There is no bleeding. Awesome. And then that's it. Okay. Dispose of all your sharps very carefully, and put this in the refrigerator until your next use. What I do, I preload all my actually all my syringes up to 30, and then store in a Tupperware, put it in the refrigerator, and just keep it there. So in the morning I just pull it, or when it's time to inject, I just pull it out, inject it, and then dispose of it without having to deal with the vial. So you can preload your syringes. So a couple things to note while you're injecting Sermorelin-Ipamorelin is that number one, you should inject it as close to when you go to bed as possible, because your growth hormone spike is the largest at night, and it's going to enhance that one spike. Number two, you should inject a minimum of 60 minutes, ideally 90 minutes from your last meal, because the carbohydrates and the fat in your meal can inactivate these peptides. So as much as possible, ideally on an empty stomach, but a minimum of 90 minutes from your last meal. I think that basically covers it. So if you have any questions, please call us at Chicagoland Men's Health. Good luck, or congratulations on starting treatment, and good luck to you. All right, great. Have a nice day.